all my viewers. Today, we will talk about the most threatening issue, cigarette epidemic. The tobacco epidemic is one of the biggest public health threats the world has ever faced. WHO reports issued every year. In the US and many other countries of Western Europe, tobacco consumption peaked during the 1960s and 1970s and declined as tobacco control programs were initiated, motivated by the evidence indicting smoking as a leading cause of disease. Cigarettes are not good for us. That is hardly news. We have known about the danger of smoking for decades. But how exactly do cigarettes harm us? Let's look at what happens as their ingredients make effect on our bodies and how we benefit physically when we finally give up smoking. Tobacco smoke contains many chemicals that are harmful to both smokers and non-smokers. Breathing even a little tobacco smoke can be harmful of more than 7,000 chemicals in tobacco smoke. At least 250 are known to be harmful, including hydrogen, cyanide, carbon monoxide, and ammonia. From the start, tar, a black resinous material, is a toxic and damages the smoker's lung over time through various biochemical and mechanical processes. Tar also damages the mouth by rotting and blackening the teeth, damaging gums and desensitizing taste buds. Tar includes the majority of mutagenic and carcinogenic agents in tobacco smoke. The tar can form a sticky layer on the inside of lungs. This damages the cilia structure, whose job is to keep airways clean, and may lead to infections as well as chronic disease like bronchitis and emphysema. Smoking destroys the tiny air sacs or alveoli in the lungs that allow oxygen exchange. When you smoke, you are damaging some of those air sacs. Alveoli don't grow back, so when you destroy them, you have permanently destroyed part of your lungs. When enough alveoli are destroyed, the disease emphysema develops. These sacs also begin to lose their bounds, making it harder to bring in the oxygen and expel carbon dioxide. Both can become partially trapped in the lungs, resulting in less oxygen delivery to critical parts of your body. A toxic gas called carbon monoxide or CO, produced by smoking, crosses the membrane of alveoli and enters into the blood binding of hemoglobin and displacing oxygen, causing oxygen deprivation in tissues, results in shortness of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters, including endorphins, that create the pleasurable sensation which makes smoking highly addictive. Nicotine and other chemicals from cigarette simultaneously cause constriction of blood vessels and damage their delicate inner lining, restricting blood flows. These vascular effects lead to thickening of blood vessels walls and enhance blood platelets thickness, increasing the likelihood that clots will form that trigger heart attack and stroke. Many of the chemicals inside cigarettes can trigger dangerous mutations in the body's DNA that make cancers form. Additionally, ingredients like arsenic and nickel may disrupt the process of DNA repair, thus compromising the body's ability to fight many cancers. In fact, about of every 3 cancer deaths in US is caused by smoking, and it is not only just lung cancer. Smoking can cause cancer in multiple tissues and organs as well as damage eyesight and weaken bones. It makes it harder for women to get pregnant, and in men, it can cause erectile dysfunction. If someone quits smoking, he or she will get immediate and long-lasting physical benefits. Just in hours of last cigarette, heart rate and blood pressure return to normal about a day. Carbon monoxide levels stabilize and increasing blood's oxygen carrying capacity. After some days of quitting cigarette, heart attack risk begins to decrease. Nerve ending or taste buds start to recover. The delicate hair like cilia in airways and lungs start recovering. Within weeks and restored about 9 months in improving resistance to infection. On anniversary of quitting cigarette, heart disease risk plummets to half as blood vessels function improve. 5 years in the chance of clot forming dramatically decline and the risk of stroke continues to reduce. After 10 years, the chances of developing fatal lungs cancer go down by 50%, probably because the body's ability to repair DNA is once again restored. After 15 years, developing coronary heart disease is essentially the same as that of non-smoker. It is not that so easy to quit smoking because initially can lead to anxiety and depression resulting from nicotine withdrawal, but such effects are usually temporary. Nicotine replacement therapy through gums, skin patches, lozenges and sprays may help to wear off cigarette, thus preventing withdrawal symptoms. With addiction of other harmful chemicals, quitting puts you and your body on path back to health, because the saying is health is wealth. So quit smoking and live your life happily. Thank you. Kindly subscribe my channel for more updates. God bless.